Hi, I'm Dr. Todd Florin, and this is Heartbeats. These are going to be some pieces that I'm going to call What to Expect. If you go on the websites, including my own, there's always a lot of stuff on what to expect when you have a procedure. So, what should you expect? Let's talk about if you have a heart rhythm device implanted, say a pacemaker or a defibrillator. This is what a pacemaker would look like. It's a small device. Let's put it up here so you can see. Fits right in my hand. Get a little confused with the spacing here. My hand looks very large on this screen now. And this is what a defibrillator would look like. As you can see, it's significantly larger than the pacemaker. Uh, these devices would be implanted right up here in the upper chest area with an incision about yay long. And it's a couple inches in, and the leads will be placed through either what's called the cephalic vein, which is in the upper chest, or the subclavian vein, which runs under the collarbone. When we do this, there are risks. There are risks involved in everything we do. When a patient asks me, Doc, are there any risks? Everything in life has risks. Everything. If I had you sign a consent form on your way to the office, and I said, well, on your way to the office, you could experience blowout tire, your brakes can go, the car can spin out of control, you could be hit by a drunk driver, you would never get on the road. If I had you sign a consent form for all the things that could happen to you in the shower, you would never bathe. There are risks when we do this. The risks are small. The largest risk is that in placing the wire under the collarbone, there's about a 1% chance that the lung could collapse and we'd have to re-expand the lung. It's built in. After the procedure, you're generally in bed for a number of hours. Most of the time we keep people through the following morning because if the leads are going to fall out, that's when it's going to happen, in those first couple of hours. And we can check again in the morning to make sure everything is where it's supposed to be. If the lung has collapsed, often we don't see it until the following morning. That's when we are most likely to find out. We'll often keep people with a sling on overnight. Why? Because you receive a lot of drugs when things are being done. And when people are drugged, they get stupid and they move around. The sling helps them keep things in place. When you go home, no sling. Why? If you keep your arm in a sling, you're going to come back to the office in a couple months and you'll say, Dr. Florin, I can barely move my arm, you SOB. Ever since you did this, I can't get my arm up. It's because the muscles constrict. I don't want you to keep your arm so still. After the procedure is done, the following day, move it around. I don't want you pitching for the Marlins, even though the Marlins aren't much to pitch for. It's not like I'm saying not pitching for the Yankees. But I want you to take it easy with the arm, but not keep it confined. You can comb your hair. Hopefully you have more hair than I do. You can move things about, routine activities. You may be black and blue. Remember that going through the blood tissue, a little bit of blood can make everything look like you were hit by a truck. You will likely be sore. It's an operation. People are often sore. But in a few weeks, everything should be back to normal. I generally use something called Dermabond. Dermabond is medical crazy glue. Why do I use it? Because it's waterproof and you can start showering the next day. I like when my patients shower. It makes the office a much more pleasant place. Patient spouses don't complain. Showering is a good thing. We like showering here in the office. Uh, we try and make things as simple as possible. You wash, you don't move your arm around too much. See us in a couple weeks. If things hurt, take some pain medicine. You're not going to win any prizes for being tough. We'll get it done. We'll get it done well, and we'll see you in the office. Thanks again, and this is Dr. Todd Florin thanking you for listening to Heartbeats.